I'm going to be discussing the kind of pivotal trials of BTK inhibitors versus chemoimmunotherapy for the treatment of chronic lymphocytic leukemia, or CLL, in patients who have never been previously treated. We'll be discussing the two Phase III cooperative group studies that were done in the U.S., the ECOG-1912 study, which took younger patients, people under the age of 70, and randomized them to Ibrutinib plus Rituximab versus FCR, where they've shown, with now about 3 years of follow-up, a progression-free survival and an overall survival advantage to the Ibrutinib-Rituximab combination. We'll talk about the ALLIANCE trial, which is kind of a sister study that was done in older patients, so patients age 65 and older, where we randomized patients to bendamustine rituximab, or BR, compared with Ibrutinib plus Rituximab. That study has shown superior progression-free survival for Ibrutinib and Ibrutinib plus Rituximab compared to BR, and no difference between the two Ibrutinib-containing regimens. That study also has not shown a survival advantage, at least with this follow-up, though there was a crossover design. And then I'll discuss the iLLUMINATE study, which compared chlorambucil obinutuzumab to Ibrutinib plus obinutuzumab, again showed a progression-free survival advantage to Ibrutinib plus obinutuzumab. So basically, these three large studies solidified Ibrutinib as a standard of care regimen for previously untreated patients with CLL, surpassing the efficacy seen with our standard chemoimmunotherapy regimens. I'm also going to talk a little bit about some of the ongoing trials in CLL in the frontline setting. In the U.S., this is going to be the successor studies to the ECOG and ALLIANCE study, the EA9161 study, and the ALLIANCE A041702 study. Both of these comparing Ibrutinib plus obinutuzumab to the triplet of Ibrutinib, Venetoclax, obinutuzumab, and again stratified by patient age. As well, there is a study that's going to be open soon, again through the U.S. cooperative groups led by SWOG, which is going to take patients with higher risk CLL that is newly diagnosed and does not require therapy, and patients will be randomized to early versus delayed Venetoclax plus obinutuzumab. So kind of another look at whether the paradigm of early intervention would be helpful for some patients.